For those who are new here, my name is Dr. Payal and I'm a physiotherapist from Delhi NCR. And I'll be your host for your today's session. So, Voices of Healthcare was created with just one clear intention to cut through the noise in healthcare and bring you clear, authentic, and experience based knowledge directly from the expert. Today, we are here with a very interesting topic that is healing in water, that is aquatherapy. So now it gives me a great pleasure to introduce our first speaker of Voices of Healthcare today, Dr. Hinal Shah. So Dr. Hinal Shah is an aquatic therapist and she is the founder of Aquaflex. She has an extensive experience in this field and will be sharing her insights on aquatic therapy and its role in healing and rehabilitation. So without taking much more time of yours, I warmly welcome Dr. Hinal Shah to Voices of Healthcare. So Dr. Hinal, over to you.
Thank you so much. I am so happy. I was not expecting so many people to come and turn up actually. Thank you so much, Dr. Payal, firstly, that you've started this platform where, a lot of people can get better insights and one-on-one conversations and such great connectivity with each other. Thank you again for, inviting me as your first guest. Means a lot. So yeah, everyone, hi. Thank you for joining. I'm Dr. Hinal Shah. I'm an aquatic physiotherapist and I have been taking so many certifications and doing aquatherapy for a really long time. And I also conduct my own workshops, which is via online and offline mode to make new young budding physiotherapists or OTist or any other therapy people who want to join and learn about aquatherapy. So we have two modes, which is one is online mode where we teach the basics and one is offline where I actually take you in the pool. We do a PPT presentation and all of those. I'm also the founder of Aquaflex, which is a pool visits program. So I have right from Borivali to Churchgate to Ghatkopar, everywhere, whichever societies have a pool in their building, I have a team of physiotherapists who go and cater and do pool visits instead of home visits. So that would actually, and we have seen amazing results with that. So that's about Aquaflex, and I have done a lot of certifications nationally and internationally regarding aquatherapy because there is very less certifications and qualifications available in India as of now, but there is growth definitely seeing in this field.
Okay, nice. So if you have any questions at any point, just feel free to type them in the chat, okay? We will address them shortly. I will be asking some questions related to aquatherapy to ma'am, okay? So that we will get more insights about aquatic therapy, right? From the expert only. Okay. So my first question to you, ma'am, is what inspired you to start working with aquatherapy?
Yeah, that's my favorite part actually. So there are a lot of people who have joined. Among y'all, there are a lot of physiotherapists as well. And our curriculum usually has, my at least did have a very small chapter on hydrotherapy in the second year. And that, just I was like, only this much information. I want to know more. What is hydrotherapy? What is aquatherapy? So I used to read articles or something about it, but that was very random. But luckily, my first job was in an aquatic setup. So there I started learning a lot of things from aquatherapy. And then my eureka moments were when I actually started taking patients in the pool and we saw 2x, 3x progress happening. So I was like, okay, this is what I want to do. And I completely stopped home visits and that's where I wanted to do everything. So I went ahead, I searched for a lot of courses nationally, internationally, and that's how I actually pursued aquatherapy.
Oh, it's really inspiring. So, how is aquatherapy different from regular swimming or pool exercises? When I put this on status, like healing in water, many people ask me, swimming wali exercise is handy way? Why? You have to join the session, then only you can know.
I also get this question a lot that do I need to know swimming? Therapist ko swimming aana chahiye, patient ko swimming aana chahiye, and what is it? How does it work? So I even have it in my PPTs everywhere that how is this different from swimming? So my biggest differentiator would be that swimming happens in maybe a little deep water and in a horizontal pattern. But people don't know only कि okay पानी में जाके चलना भी है, पानी में जाके squats भी करना है, ये सब भी possibility है और बहुत अच्छे से भी हो सकता है पानी में. So everything done in a vertical alignment is the main differentiator from a horizontal alignment of swimming, and it's done in like a shallow water. So you don't need to know swimming, neither the therapist nor the patient. I think Deepak Jain has a question.
You can ask your question, Deepak.
Can I be audible? I don't want to type the whole thing. It will become a very long paragraph.
Please go ahead.
Yeah, hi Hinal, you must be knowing me. We have been on the chat continuously. Actually, I have been following you from pretty long time, and I myself practice aqua in my own city. I have been doing mostly aqua yoga and the basic of aquatics. And there's one certain question which I have been very, particular about. Ki how is there any, different types of protocols when it comes to knee and hip specifically, and in the neurological scenarios. And usually, in my city, in my state, people are very lack in the education towards the medical sector. So they always try to merge hydro and aqua together. But as far as I have read, it's hydro and aqua both are different things. So what is the the dot point you want to bullet point you want to mention, regarding the same key? How can you differentiate that? The one thing can be the temperature. Other than that, what is the major difference?
Between hydro and aqua, or like knee and hip joint?
One question was knee and hip protocols. That is one thing. And where we can get the reference from other than the research articles.
Yes.
Usually I go through the Zoom video, which is Zoom all with the ATNI, which happens through Prashant sir. But still, because I've been seeing your videos a lot, so I've been watching them. So I want to know where you are actually reading them and where you're going through them, whether research protocols are there for them or not.
Correct. Okay. So about the research protocols, we'll take them first. See, now since there are not a lot of books or anything available on aquatherapy, but PubMed does have a lot of articles which mentions like a comparative study also on what protocol was used for a certain patient and what was used for another one. Apart from that, currently, very sadly, but internationally, we have more programs and more theories available regarding that, and lesser on our Indian websites and all. But you can surely refer certain articles and researches actually from some other person who is doing aquatherapy or performing aquatherapy. So I think our greatest source of learning in today's times are Instagram. As you said, you've been watching my videos. There are a lot of videos and people actually who do this therapy, and they have been putting up so much content lately that they help us learn and grow. Okay, this can be done, that can be done. So currently I would say read on articles, read on online websites, and refer pages of people who are like aquatic pioneers from some other country, not India, because currently there is nothing available as such, and there are only few aquatic therapy centers that have recently set up. So even we follow those protocols that we have been working and we have been seeing and observing and creating on ourselves.
Sorry to interrupt you in middle. You talked about the theories which has been already been there in the international sector.
Yeah.
Is there any chance of getting the ability of any kind of link or any kind of PDFs which you can share in the group that will be helpful to read along?
Definitely, but there is not one specific article or a PDF where you have everything. So if I have to, that is the problem. Aquatherapy is very new, and we don't have like this fixed book or something in hand or a website like Nikhil asked me. But I don't have that one particular thing. If you ask me for like knee, I have one thing. If you ask me for hip, I have one thing. So we as therapists have to create that together. Okay,
I think you have to write a book on that.
yeah, I think I'll
Publish
only
your
have to
one.
write a book on it, where I will be mentioning each.
Okay. Sorry to interrupt you. Continue.
Okay, so that was one part. But see, definitely when you go and type aquatherapy or read about aquatherapy, you can go on PubMed and start with articles with aquatherapy or aquatic therapy knee, aquatic therapy hip, and you do get amazing articles from Canada, or there are 2 3 professors in some other university who have written them, and they are good. There are articles on stroke as well. There are articles on pregnancy. So each aspect there have been separate articles. So, but those are really good. You can refer them. And your
Okay.
second question was hydrotherapy and aquatherapy. So, a very interesting fact actually about this is hydrotherapy is a very ancient term that has been used. Initially, like the Romans or even in our Ayurveda, we have been using a lot of hydrotherapy. We just didn't know that, okay, this was called this or this is used for healing. Like, till date, if you ever go to a resort and you sit in a jacuzzi, it's relaxing for you, it's healing for you. So when you sit, just sit. I'm not even saying like do any exercises. You're just there in the water. Water in itself is and has a lot of healing properties. So those were used by ancient Romans. Those were used in our Ayurveda. Manikarnika hot water springs. They're still active, very much live. And these are all the things that we can call hydrotherapy. But aquatherapy is something that we all modified. We as therapists or the pioneers and everybody just came together in aqua and we called it therapy because we actually put a lot of things into it, and we called it the therapy aspect. So it can be done in cold water, warm water, both. Aquatherapy is a broader version of it, not just warm water.
Maybe I might be wrong because recently 13 or 12 days back I read an article in the public PubMed where comparing the difference between hydro and aqua. So they were pressing on the point that okay, aqua can only be done on the hot and hydro can be done on hot and cold. So that is why my question came up because you have been practicing pretty long. You have been in the international sector, so maybe that will be much clearer to the zone of this both comparison whether it's wrong or right actually.
Correct. But see, now they are just terminologies. Like if you use Bombay or Mumbai, it's kind of in a similar pattern. So that's what has been put up in a lot of books and even in the courses that I have done. So if there might be some article where hydro and aqua have been defined like this, it could be one of the perspectives that people see it. But I can assure you that if I'm saying that if I go to building pools and do it, there is no warm water pool available everywhere. I think this misconcept I have to actually, I wanted to address it to every physio because we've been thinking that aquatherapy is something very premium. If you have a setup of a, you should have or something, you can just start because water in itself has a lot of other properties. Temperature is just one of the properties which we use.
Okay. I'm sorry. Maybe I'm been asking the more questions around there. Around a year back, I went to quite hilly in the Watsu. You must be knowing it, right?
Yes,
To add a part of aqua yoga in my setup because I don't have a setup, but I'm practicing in a one pool where it's all thermal temperature control and all.
correct.
One thing I found was she was Petra was specifically pointing out the temperature because she said that when you're working in the cold water the energy of the muscle has to muscle have to work more because its temperature is controlled and your body has to adapt to the temperature inside the water because
Correct.
if the temperature is low then you have to produce more heat that will make your muscle tired earlier compared to what you are seeing in the temperature control pool. So that is why I started searching on the PubMed and then I found this article. So that's why I was like, okay, I was sure that it can be done in both, but
Yeah.
because of the article, it was getting more confusing after some
No,
period of
so
time.
basically, what you're saying, Watsu, is like a passive relaxation technique, firstly, and that is supposed to be initially, like in the books, if you go by the method, it is only supposed to be done in warm water because that method and the technique is used for relaxation. But when you say aquatherapy, what about cold water plunges then? You all do ice baths, you all do ice bath challenges. So even that must be having some effect, no? So that is when muscle soreness is there. It depends on the condition. That's what. If you're doing Watsu, I would prefer warm water.
Correct,
If I'm
correct.
taking a neuro patient, I don't want spasticity to increase. So I will take warm water. If I'm taking aqua fitness, now you tell me if the water is already warm and I'm doing fitness, like I'm jumping, I'm doing HIIT in the pool, I will feel breathless. My body
Breathless,
will be
yes,
like, my body
correct,
is hot, the water is also hot. How will I manage? So
correct,
that's
correct.
what there are a lot of other aspects in aquatherapy which you need to know. It's not just one thing. Okay, aquatherapy, you go in the water, you exercise. There are so many neuro aqua is different, pediatrics is
But
different.
ragas and all, WST and
Yeah,
but
but
ragas.
everything.
Okay, 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 okay.
Thank you so much, Mr. Deepak, for asking these insightful questions.
Nikhil has something. One is he asked me about the website, and second was from where I take inspiration or read books or papers.
Yes.
Again, Nikhil, honestly, I'm telling you, I refer a lot of Instagram pages. I refer a lot of international people. I keep searching for people who are doing Aquatherapy online, and that's how I take, because I have done courses from a few particular people, but that I didn't want to stop there because they have one particular method. And honestly, after doing the course, when I started doing things practically, then I did not relate that. Matlab, it was only 5 to 10% which I would use in my therapy actually till date. So then I started taking and learning by myself. So uh, Deepak, again, share some good Instagram page link. You can always refer my page, Aquaflex Dr. Hinal. It's a very
And if
good
I want to
Instagram.
go forward ahead of you, then
Yeah, so please refer my page. And also, honestly speaking, there are a lot of other pages as well that give out a lot of good information on it.
Okay, so moving forward, so ma'am, can you share a patient story where aquatherapy made a significant difference in recovery?
100%. One of my favorite stories would be about a patient which was age 26, and he had juvenile RA. So he didn't look 26, but if you know, RA is a case of where there is a lot of spasticity in the hands. उनके ना हाथ जकड़ जाते हैं, पैर जकड़ जाते हैं, the knees are into flexion. So that is the kind of, imagine the state. And that boy used to, actually his father used to lift him up and get him to the pool. And since this is a proper aquatherapy setup where I work, so we have a pool lift also for the transfer. So that's where, he used to put, that father used to literally carry him from the rickshaw and put him on our pool lift. And when he entered the pool, which was like a 4.5 5 feet pool, he was walking. He literally used to walk with us without any support. So he used to say the sentence that, after 45 minutes to 1 hour of his therapy, he used to tell me that, can I just walk in the pool, because this is the only place where I come for a walk, because he can't walk or he can't do anything on land. So that's how empowering I thought water could be. So that has to be my favorite patient story.
Right. So,
I want to add on this.
yes.
Sorry to interrupt you. Actually, I want to add on this. Even I got a case that is the function of the kid. It was like phenomenal for me because they were referred from the Dr. Ashok Shet, Mumbai. You must be knowing Dr. Ashok Jori. I'm sorry.
Yeah, yeah.
You must be knowing him. And he said that only aqua will help him. Nothing will help. And so recently, that time I did the aqua and all, so 2 years back. And it was phenomenal for me to see that the result was so good. And because of that, I started transferring my clinic towards more of aqua rather than comparing to the working in the clinic in the land. That is what is happening.
True.
Ma'am, Nikhil is asking a question. Is it that
Okay.
aquatherapy is useful in neuro and pediatrics, or even ortho cases it makes difference or not?
Neuro is definitely where you see a lot of changes, because one, you become independent. So like dependency to independency is like a huge thing. As I said, pediatrics, CP cases, even hyper child, they get that sense of calmness and sensory integration a lot in the pool. So pediatrics also, yes, spasticity reduces. We can do a lot of stretches, active movements in the pool. And ortho cases, you see the fastest results. If it's a post TKR, it's a fracture case. If it's just knee pain, back pain, normal paraspinal spasms, or anything, we get amazing results and very fast, because they are very acute cases, not so chronic. So the fastest results you will be getting would be in ortho, and highest cases that I see are ONE. ONE and OME. So they're like knee pain, because once when you're inside the water, you're non-weight bearing. So they are all, obese people, 50 age plus, aunties and uncles, and they come and they're like, ONE, and I can't do this, my walking has stopped, I can't I can't do household work. So one is, when you enter, the minute they enter the water, they feel better, because the knees are our most weight bearing joint. So they get relieved of those weight. And in water, be it warm or cold, again, there is a lot of massage or a effect which gives the muscles a kind of relaxing and calming sensation. So the muscles and the joints are taken care of, which is the major in OA. Any grade of OA that shows the result, or is it that you have seen result in all cases of OA? Definitely. But of course, grade 4, where they have been suggested surgery, we can prolong the surgery for some time, but it can't be that it can get resolved, because there is literally no cartilage space left. So I can't say that that can happen. But yeah, definitely, if they do like a pre-surgical rehab and a post-surgical, after of course the stitches have been healed, then you see a massive difference because they've never done strengthening in their lives. And aqua, you literally have to push the water. You have to push the water on all sides when you do the movement. So strengthening can happen very, very beautifully.
Okay. So moving forward with basic questions. So who are the ideal candidates for aquatherapy?
Yeah, as even Nikhilas and you were addressing, everybody can do aquatherapy. Depends on what kind of therapy they want. So if I say pediatrics, then it's pediatric aquatherapy, where some you need an aquatherapist in the pool, and that needs to be a warm water pool again, because that's a little relaxing for the children. Then if you talk about geriatric population, old population, then they can also come in their pools. The ortho cases, be it neuro cases, or maybe somebody who just doesn't want to have any ailments or something, but they just want to do fitness. So there is aqua fitness for them. So literally anybody and everybody is more than welcome in aquatherapy, and they are going to just benefit from it. That is for sure. Definitely, apart from a few contraindications, where if you have an open wound, or if you're like a burn patient or something, you have an active infection or fever, then we definitely would avoid. But apart from that, it works wonders on each and every one.
Okay. So, how do properties of water like buoyancy and resistance help in recovery?
That's another very good part of aqua, is that there's no gravity, but to cut the gravity, there is buoyancy. So buoyancy would, if you all everybody has studied some physics in school, so buoyancy is nothing but where you float. So one would be that if you're on land, and if I'm doing a basic SLR, or just आप अपना पैर उठा रहे हो so that is going to be a little difficult because you have to cut gravity. But if you're in the pool and there is no gravity and there is buoyancy, और आप पैर उठा रहे हो, तो वो पानी help कर रहा है आपको. So like your leg is going to go up because of the floating. So if your range on land is some 30 degrees because of pain, then it will automatically be 40 degrees in the first session without me doing or you doing any exercises or anything. So that's the power and the difference where floating and gravity would actually help. And about resistance, see, as you so there's resistance from each direction happening in the water actually.
Okay. So, I guess Deepak is asking, what about spina bifida case?
100% spinal, not just spina bifida, but a lot of other cases also. Whenever you take the patient supine or even prone, that is possible in the water. If you have like a railing, or if you have some flotation aid and you can take them, then it really, really helps those patients, because again, weight bearing is not there. So it's very much beneficial that, see, even if you're like lying down, or even if like imagine kids, how much they must be facing the agony and they are unable to speak about it. But when the water and they're playing, or even if you're in supine and your spine is completely offloaded, that's the best part. There is no pain when you perform activities.
So, aquatherapy have any effect on mental health? Is
100%.
okay. Mental health
Yeah.
and stress levels.
100%. So, whenever we have a memory of a pool, like it's always recreational. We, have been to like a pool party, or we have been to a jacuzzi setup, or we have seen, playing in the pool, or we go to a villa and we always book a villa with a pool. So, that idea of being in a pool is always associated with fun. So, if it's children in the pool, they are also having fun, splashing water around. If they're adults in the pool, they're playing some game, they're just swimming. The idea and the concept of psychosomatic pain actually gets resolved in the water, because you're like, okay, this is some new medium, some adaptation is happening, some other thing is happening. So your focus is completely off other things, and you're like, okay, you're present, you have to balance also, you have to strengthen also, you're there doing something new, and plus you're splashing water, you're having fun. So the ideology and the concept is a lot about having fun in the water.
And ma'am, how you deal with hydrophobic patients? Like if someone
Yeah. Mild hydrophobia, everybody tells me कि हमें swimming नहीं आती है, आप पकड़ोगे ना, हमें ये नहीं हो रहा है. So mild hydrophobia would be all the therapists, you all have to actually hold the patients and convince them कि आप नहीं डूब सकते हो 5 feet water में, even if you try it, आप नहीं डूब सकते हो. So that 1-2 sessions would definitely go. In mild hydrophobia you can take, but if somebody has this trauma that they've been through, कि डूब गए थे, या they've had a bad incident in the pool, then if initially we try to convince them, but if they don't, then we kind of avoid those patients, because one is कि कुछ अच्छा करने से better it would get worsen, because they might have a panic attack because they are not used to. But the beauty is of aquatherapy is there are levels of water. So maybe take them in a very shallow water first, so that they are not scared, because usually they are scared when water comes to the chest level. But if there is water only up till their knee, or if up till their waist level, then I think they should be fine.
Hmm. Okay, I guess somebody's asking. Yes, Mr. Sashank. He's asking, may I know what type of patient needs aquatic therapy?
Hi. So as we discussed, all types of patient can take aquatherapy, be it pediatrics, geriatrics, ortho cases, neuro cases. Everybody can take. Just depends on if you are the therapist and you want to. You can decide on assessment how much and which patient would actually need aquatherapy. If you think they are going to benefit in a non-weight bearing position, then that would be your call to take him or her in the pool. And if you think more weight bearing and all is required, then maybe you can start with the combination exercises of land and aqua, or land. That completely depends on you as a therapist on your assessment.
So Nikhil is asking, what are the practical difficulties you see in a clinical setup?
Okay, hi. One would be maintenance. The cost of maintaining a practical setup is very, very high, because see, things in water, no, they tend to break, they tend to get a rust, and they some or the other issue, something is not working, other thing is not working. One second, very important would be that transfers. So if you have a pool lift or you don't have a pool lift, you still can transfer patients, but once they come out, the floor is wet. See, now this is a very practical problem that actually occurs when you work in a setup. That because see, they are patient, they already don't have a good balance, and the floor is wet. So you really need like one or two helpers there to safely transfer them into the washroom or the changing room. So I think these two are main. One is management and sanitization of the pool, and second would be that the area around the pool that really needs to be taken care of.
This is my question, ma'am. Is there any side effects of being in water for a long time? Like, आपको बहुत सारे sessions लेने पड़ते होंगे, so
Correct.
like, so is
See,
there any side effects?
yeah, if the pool is, good, the filtration, everything is good. I've been like working non-stop every day in the pool, so nothing as such. Just be moisturized. One thing very important would be, because in water you get a lot of dehydration on your skin and your body as well. So keep being hydrated. Either you can have electoral waters and everything, because that takes a toll, and be use a lot of moisturization for your skin. I don't think apart from that I've faced any issues.
Okay, so the last question, what is the one key message you want the audience to take away about healing in water, about the session?
Awesome. Healing in water would actually mean healing in confidence, healing without any stress, being in a very happy, injury free environment. So you do try it. Just try it.
As we come towards the end of this today's session, so I'd like to sincerely thank Dr. Hinal Shah for sharing her knowledge and experience with us.
Thank you
And
so
thanks to
much.
everyone who joined us today and actively participated and asked a very nice questions. So stay connected with Voices of Healthcare for more such meaningful sessions.
Thank
So,
you so
ma'am,
much. This has been so good. Thank you, Dr. Payal, for inviting me, and thank you everyone who actively took a part in the session, and you all were so interested. Thank you so much.
so everyone, you can react on this chat if you like
Yeah,
this.
because I want a picture of your reactions. Awesome. Thank you so much.
Just stay connected with us. More sessions will be coming.
Thank you. I hope I could cater all your doubts.
Mhm.